Um, Thank you for spending time with me today. And I know everybody has very busy schedules, and I hope to make this informative and give you some insight on how to do more chairside milling with a really beautiful material called katana. So I'm just going to get right into it. Please feel free. I have my Q&A box open, and you are welcome to type in your questions as you go. And if it's appropriate time to break, I'm happy to answer those even throughout the presentation. So first, let me give a thank you to Karare Noritake for their support of this presentation. I've been working with katana for the last year or so. And honestly, it's just such a beautiful material. And it's such a great company. I've only had great experiences with them. And hopefully you'll see why I have really embraced katana as a material in my practice, and why I've chosen to use katana in my chairside milling of zirconia. Before I get to that, a little bit about me. Since we don't have video, I like to put a face to the name. This is me. My name is Jenny Apekian. I have a practice in Sacramento, California. I moved to this space. I bought an existing kind of smaller practice, 4-out practice. Back in 2013, I was practicing at that point for about 6 years. And bought an existing practice, grew out of that space pretty quickly with the introduction of Esthetic, and I really just embraced the digital workflows. And I attribute a lot of my growth to digital workflows, efficiency, and moved into this space in 2017. Now we're at about 11 operatories in my practice. We have 3 doctors, including myself. And, when you walk into my practice, it's pretty clear there is a kind of up-to-date, advanced sensation or feeling that a patient may get. And that was by design. And I bring this up because I think there are ways you can incorporate this into the design of your practice. If you are a digital practice, if you are scanning, you don't have to build out a whole new office, but really incorporate that, because I think patients really appreciate being a part of these workflows, understanding what you do. And especially with Esthetic, which is, the scanner, I have the Prime scan in my practice. We have 3D printing in my practice, Prime Mill and MCX, CBCT, all of these things are really showcased through the practice. And I attribute a lot of that to the growth that I see. I call it my internal marketing campaign for my practice. And with Esthetic, what Esthetic has allowed me to do is really gain control over the final product, be able to improve the outcomes, especially aesthetic cases. And I'll kind of walk through some cases today. I always have a picture of my team because now we've grown even further from this picture. We're a group of 20. And I bring up a picture of my team because it's really hard to grow a practice and incorporate these digital workflows alone. Whether your practice is 4 people, 10 people, 20 people, I think that delegating responsibilities, training your team is a huge aspect of digital workflows. And a lot of these parts and pieces get delegated to my team. And then I get to focus on all the things I really love to do. So I'll get to some of that, especially when we get to aesthetic dentistry. And that's just really what I thrive with. So as far as today, what I want to cover is understanding case selection and identifying proper diagnostic records for success. So we're talking about our more comprehensive cases, our aesthetic cases, and how to identify, what material is best in that particular clinical scenario. I'm going to discuss preparations, pre and post mill contouring, staining and glazing techniques for beautiful and consistent outcomes, and common tips and tricks for improving aesthetics. Hopefully, even if you're not designing these cases and milling them in-house, I think these things kind of give you some understanding of what the lab technician is facing in providing aesthetic outcomes. And I think that's the big takeaway I took home when I started with CEREC, is the ability to understand what I need to do on the front end to allow my lab, or in my case, myself, allow myself to be able to create consistent and really beautiful outcomes that we could deliver time and time again. So these are the cases that I really commonly did in my practice. This particular case is a full mouth of Emax. We increased VDO. We did this over a series of appointments. And I was very, very comfortable providing this kind of dentistry in my practice before even starting with Katana. I was a lithium disilicate girl. I did a lot of Emax in my practice and still do, and I still value the material, but I'd say that more and more growingly, I'm seeing a lot of cases that could benefit from zirconia. And I'll talk to you a little bit about what brought me to the conclusion and why I started in the first place. But these are the outcomes that I was getting with Emax, and I really, really value, the ability to select different materials for each clinical scenario. And my philosophy was, if it ain't broke, don't fix it. I was getting great outcomes with Emax, and I didn't really see a reason why to switch. But then, in comes Shannon. Shannon comes in with her primary reason she came to my practice was an Invisalign consult, believe it or not. She said, this space is opening up between 8 and 9. She had no idea that she had an abscess on number 8 and vertical root fracture. She had a failing tooth there. So she was very caught by surprise that she needed her tooth extracted. We did an extraction, and we ended up doing some bone grafting. But even with bone grafting, even though the tissue looked really beautiful after the extraction, she just did not have that facial plate, and we couldn't rebuild it. So an implant was not an option. And this is where I think I had challenges with Emax. Even though it's an indication to use in the anterior, every time I did an anterior Emax bridge, because we had to have such a big connector, I just could not get a really solid or beautiful outcome at the Pontic site. And so this was actually my very, very first aesthetic case. And I started seeing pictures that other clinicians posted of Katana, and these were either in-house fabricated or lab fabricated. And I was like, you know what? I'm going to give it a go. And in comes Katana, and we decided to go ahead and mill a Katana bridge and a single veneer. So that's 7 through 9 bridge and number 10 veneer. And this was the result that I got on my very first case. So I was just really thrilled with that. The patient was super happy because she was so, coming from the disappointment of knowing that she was not an implant candidate to having an outcome like this. Both of us were very, very happy with this result. The other thing I noticed with Katana is that we could just get these really beautiful crystal glass smooth surfaces, smooth margins, and that milling of a thin margin was just way superior over some of my lithium disilicate cases. So this is the workflow with Katana in my practice. I have a prime scan, and we do some intraoral scanning. We send it over to our prime mill. I do dry milling. With dry milling, we could do that in, between 8 to 12 minutes, for instance. I usually don't do speed milling, but you can. And we have katana blocks, and we use a speed fire for sintering. Most of my bridge cases, if it's a bridge, anything over 6 millimeters, certainly a bridge would be over 6 millimeter. It's going to default to a 30-minute sintering in the speed fire. Of course, there's other, furnaces and other milling units that can be used, but this is my workflow in my practice. And certainly, if we wanted to do 1 or 2 same-day restorations, we can do that. Generally, when I'm doing these kind of more comprehensive cases, I'm temporizing the patient and having them come back. That's my workflow, just because, I find that chair time just gets too long at that point. And, katana is really beautiful because the other thing I love about it is that it is, it's called STML, super translucent, multi-layered. So what that means is that dentin or body layer is going to be more opaque, kind of block out the stumps better. And then as it transitions into that enamel layer, we get some more translucency, just a really beautiful lifelike appearance. And it helps me block out, like I said, as that porcelain gets thinner near the margin, helps me block out those stumps a little bit better than even, an MT Emax block can. And we're getting really beautiful margins with this, especially the other thing that I started noticing as I do these is that, those cases that I have kind of, even though, it's not an indication for a feather margin, when I have those instances that I have a feather margin or don't have that perfect margin, I just feel like katana performs a little bit better in those instances as well. And making the switch to katana, it didn't really, as far as my preparation, it doesn't really change my preparation. If anything, I can be a little bit more conservative because we can get that katana really, really thin and still maintain the strength and quality. So as far as preparation style, it's pretty much the same, just a little bit, we can be a little bit more conservative there. And as far as translucency, it's very comparable to Emax. And as far as strength, it's significantly stronger than Emax. So Emax, we're at about 400 to 500, and katana itself is 748. Recently, they came out with something called Katana 1, and this is a block that actually has a higher flexural strength, all the same aesthetics as katana, but I definitely use Katana 1 more and more, especially in those instances that I have minimal thickness. Again, same 18-minute sintering time, and it's been shown to extend burr life. So it's a little bit softer in the pre-sintered state, so your burrs last a little longer. And the reason it says streamline inventory, so rather than, in katana, we have a size 12 and a 14 as options. It all comes in one size, that's a 13, so you don't have to select the size, or if you load the wrong block, that happens on occasion. You don't have to go back and correct it. It's all a 13 size block. And, I'm kind of a believer in using the material, the cement that was tested with the material. So I also am now using Panavia SA. It's a dual monomer technology, which means that it has a hydrophilic monomer and the original MDP. That Curare was the first company to come out with MDP, and it's been shown to bond to dentin and enamel, zirconia, and metals. So it's a really, really great bonding, very simple to use, easy cleanup. And so making that switch was very easy as well. So what I found was that with Katana, even for my single crowns, even though the original reason I got into Katana was through, having to make some bridges, what I noticed is that I could be a little bit more conservative with my preps. So I'm using it more and more in my ultra conservative preps, as well as my minimal thickness areas. I'm getting better anatomy and better margins when I mill, because it's milling 25% larger than what the actual post-sinter crown will be. So when it mills, if you've never milled any kind of zirconia, it's kind of this powdery, very sensitive, brittle material. And after it gets sintered, it actually shrinks. And because of this shrinkage, it's allowing for that, occlusal anatomy that's being milled with our carbide burrs and our prime mill. You can do an extra fine mode that really, really gives you beautiful anatomy. So it's giving me better margins, better anatomy, and certainly higher flexural strength. And it's actually more cost effective than Emax blocks, for instance. So it's actually less expensive too. And then we know with research, we can bond to zirconia. So those fears of bonding with the proper bonding protocol should be alleviated. And the other thing I noticed, especially in my deep prep situations, those that go very deep under the gum line for whatever reason, whether it was intentionally or because of decay or fracture, that polished zirconia next to gingiva is just, the gingiva just loves polished zirconia. And so I've been noticing, really great tissue response to the polished zirconia as well. So in walks Sydney. Sydney came in to me because she wanted aesthetic treatment. She had breast cancer, and she feels that the radiation treatment kind of contributed to her current aesthetic concerns. She had previous history of perio, and teeth were long and canted, even though her perio was actually very stable and very healthy. Now it was that history of perio that just kind of wreaked havoc and gave her this kind of unaesthetic issues she's having, certainly some staining and other things going on, but she just wanted to be able to smile with confidence and didn't feel like she could. So here she is on clinical exam. And what we found was actually her previous history of perio led her to lose 24, 25. She had history of bisphosphonates as well as a result of her cancer treatment. And we really wanted to minimize the amount of surgery we did because they were pretty low risk extractions. We took out those teeth, didn't do any kind of grafting or anything. And this is the result we ended up after some healing. Her bite, she had very canted teeth, a deep bite, obviously some root exposure, some staining, and a lot of erosion, a lot of wear. She had some posterior, gold crowns, actually in good function, and she really just wanted to address her smile line. So we started kind of working up her case, and her the most challenging part of her case was this extreme, diastemas that she developed. And we talked about orthodontics. Sydney's in her 70s. She really didn't want to have to go through orthodontics to get to where she needed to be. So we talked about some of the compromises that she may have to make considering that. And we decided to move forward and consider, putting restoration, second premolar to second premolar, just whatever was really visible in her smile. So like all my cases, we start working up with facial aesthetics. I'm kind of spear taught, and we start thinking about facially generated treatment planning. This is a workup I do on every single aesthetic case. This is how I determine if I need to change vertical dimension. And in Sydney's case, we saw that, you know, this is called the rule of thirds. And facial aesthetics, we want kind of the upper third to equal the middle third to equal the lower third. And generally, she was pretty symmetrical in that sense. So I did feel like in terms of achieving some of her goals, we could do so without having to change her vertical dimension. But what we found is that she was very, very canted. Her inner pupillary line was not straight. Her teeth were canted, but her midline was pretty spot on. So these are all things you could do. You could just pull up a PowerPoint presentation and load patients' photos. And these are all ways I kind of help determine what we're going to do and how we're going to address her particular case. And like any kind of spear-taught dentist, we start by looking at 8 and 9. And in Sydney's case, I really actually liked the position of tooth number 8, and 9 looked longer and 10 looked longer. And so by using 8 as a guide, and just like setting denture teeth, we start kind of placing where we want them to be. And in this view, I'm not only looking at the teeth, but I'm looking at the gingival zeniths. I'm looking at if this patient has a gummy smile. And in her request to kind of minimize treatment but maximize outcome, we decided to go ahead and address her smile line. Like I said, second premolar to second premolar, minimizing the amount of gingival work we have to do because she didn't, she wasn't showing too much gum tissue. With this in mind, we went ahead and worked with the laboratory to get digital mock-ups. At this point, I'm doing all of my own mock-ups as well. So I have a lab assistant, and I've trained her to do virtual diagnostic mock-ups. And these are excellent in helping us determine if we can, in fact, achieve some of our goals. So the mock-ups are really, really helpful. What I like about doing them myself is that sometimes I see some of the issues before they arise, before I get to my prep appointment. And so every single case, if I'm doing, more than 4 units, is getting a wax up for me. And what we're doing is we're 3D printing that wax up. And at our prep appointment, what I do is I go ahead and reopen my original scan from my records appointment. And in CEREC, it should be familiar if you guys are using CEREC. We have different catalogs we can add. The more catalogs, the better, in my opinion, because we're using these as reference points. So in this case, for instance, you see the upper arch with prep teeth. You see the lower arch. This isn't Sydney's case, but in Sydney's case, you would see prep teeth on the lower arch. You can see that I've also left the first and second molars unprepped, but I've scanned all of it. The reason is because I'm using anything that is not prepared as something to correlate with. So what that means is in the gingival mask folder, I'm using those molars to be able to correlate the images from the prepped catalog to the gingival mask catalog. Gingival mask, it could be called anything you want. Just consider it a digital file. So in this case, I'm using the patient's existing dentition as a guide, and I'm also using the wax ups as a guide in the biocopy folder. So in Sydney's case, we're actually going to have 7 catalogs because in addition to what you see here, you're going to have a gingival mask lower and a biocopy lower. So we have all of these different files to be able to correlate the images. And I like to confirm the correlation, meaning, so before I've even prepped the teeth, I want to see that green check mark to make sure that these images can all be correlated. And when you have not prepped the teeth, you can actually see all of the information overlaid, and it helps you guide your prep as well. Some people like ordering prep guides. I personally just like visualizing it in my CEREC, and that's what I do. I 3D print in my practice, so we're 3D printing our temporaries, but certainly if you don't have a 3D printer, you could just take a putty matrix of the wax-ups, making sure that you're involving the unprepped teeth to use as a guide to see. So in Sydney's case, we are taking a putty matrix of the full upper arch, including the unprepped molars. And so once the front teeth are prepped, you can use those as a guide. And I like using the palette for that reason too, when it's an upper arch. So here's Sydney all prepped. We can see some darker stumps. I love taking pictures of stumps because that really helps me in guiding how I might design the case. If I want thicker porcelain in some areas, if I want blockout. This isn't a major discrepancy, but you have some stumps that are very, very dark. That will show through with katana, certainly if you're getting it very thin and doing very conservative preps. So something to consider, and it's great to have these reference photos. So some tips and tricks, like I said, correlating images, you always want to think about what is staying constant, right? In Sydney's case, those molars are staying constant, so make sure you scan them in their entirety. I also like to scan palates. So for instance, if we're going first molar to first molar, the palatal rugae sometimes helps correlate those images too. If all else fails, go ahead and scan the temps for biocopy catalog. So sometimes we have a hard time kind of getting references to correlate. One thing that can be done to make sure that they correlate is cut out all that extra gingival. All the mobile tissue needs to be cut out. If you're scanning a 3D printed model, you don't want to scan the model kind of base that is not in the patient's mouth. Just think it has to relate somehow. So cut out all that extra gingival, see if they correlate. If they don't correlate, go ahead and make your temps from your putty matrix and scan that. And that's a great reference to have. Always take photography. If you're not using photography for your aesthetic cases, you're really doing yourself a disservice. And even afterwards, as I've been taking, because I present a lot on these cases, the photography really helps me learn to improve. There are so many things that you don't see, when you're doing this kind of dentistry. Even when I'm seating a case, sometimes before I seat, I'll take a photo to identify if, for instance, I need to use opaque cements or something to block out stumps. These are all things that kind of help give you the outcome you're looking for. And, if you have some issue with the temporaries, say you put the temporaries in, you're like, I don't really like those temps. I don't know what I don't like about them. Take photos of the temp. Take photos with the patient's whole face with retracted lips so you could see the temps in relationship to her face and eyes. And these are all photos that I use during the design phase to help me identify things I want changed or maybe things that I want to duplicate. Always evaluate your gingival zeniths as well as your incisal edge positions. Certainly for those patients who have gummy smiles, I think this is what takes an A case to an A+ case, is really paying attention to the gingival zeniths. Always have backup plans. So when if I'm doing a full mouth case, after I prep the anterior 6, typically my workflow for a full mouth case is I'm prepping the anterior 6, both top and bottom. I'm taking a bite registration of those prep teeth in the anterior, because once I prep those posteriors, I lose the bite. And, you never know with digital what happens because, of course, we all know digital works 100% of the time, right? And if you've ever experienced, something crashing or a battery dying or something not saving, you realize how important it is to have backup plans. When you take your double buckle bite, you always want to seat the patient up. I like to do it before they're even numbed. So I go ahead and that's the first thing I do. I seat the patient up, have them bite down, because after you've prepped all these teeth, they might be fatigued. They might not bite the same way. We're including those unprepped teeth because we're trying to create those reference points. So seat the patient up, get them in a reproducible bite. Double buckle bite means the patient does not open after you take the right side bite, for instance. So take right, left, while they're still closed in the same position. Very important. And if you're doing these big cases, especially full mouth cases, if you're early on, formulate a timeline, meaning, if you have a workflow, in my workflow, I'm prepping the anterior 6, top and bottom. I've identified how long things take me for each kind of, important point in the timeline so that I keep on time, because these are very long and fatiguing appointments, both for you and for the patient. So it's great to have an understanding of your time. It's great to understand, if your time is improving, because as you get more comfortable with these cases, you get a little faster. But fatigue is a real thing. So we really want to kind of try to hit those marks, because we don't want the patient here, for 6+ hours doing these kinds of cases. And, here we are after preparation. And this was a case that was submitted to my lab. This was a wax up that was made by a lab technician outside of my office. And, after seeing the temps in the mouth, I just didn't really love the contours. They're kind of bulbous. So what did I do? I went ahead and took some photography. If the patient is still numb and you find it very important to be able to see that smile line, have the patient return when they're not numb again. Take some photos of their smile when they're not numb, because it's important to kind of see all of those aspects in formulating your design. So what I love about doing all of this on my own is we can correlate these images. So here is my initial design overlaid with her natural teeth. So it kind of helps me identify, are we getting where we need to be? And while I have this image up, I have this one up as well. I love to be able to look at the cant and be able to see this photo while I'm designing. So this is a really important photo for my workflow, to be able to idealize the incisal edge positions. And also the other thing that helps me is when I prep the images, correlating these images with my biocopy helps me identify if I've had enough reduction too. The worst thing is when you start designing and then you realize you didn't prep properly to give you the ultimate goal that you're looking for. So these digital images, the catalogs, really use them to your benefit. And here we are with Sydney's final restorations. Like I said, we went second premolar. She was really thrilled with this result. Here's her before and after. And like I mentioned, what I felt was the most challenging part about her case was to be able to get something that looked reasonably acceptable with those huge diastemas. I mean, you could fit a whole tooth between 5 and 6. But what you start learning in designing your own cases is a situation like this. I am well aware I have to prep very deep on the mesial aspect of number 5 and very deep on the distal aspect of number 6 to have some runway space to close the embrasure without it looking fake or wide. So this is as natural a result I think we could have gotten with those huge embrasures and diastemas like we did. And we ended up with a small 4-unit bridge down at the bottom. 23 through 26, and really kind of conservative way to approach her case. Obviously, covered up all those erosion areas, gave her a more functional bite. We maintained those molar crowns because they were fine, and she was really happy to be conservative there. And the change in her aesthetics, I mean, certainly I feel like we took 10 years off her face, and she, her eyes even look more youthful to me. She's super, super happy with this outcome. And she's been in function now for about a year. So some tips and tricks with smile design. Like I mentioned, use photography. Make sure you're taking the proper photos. Use the photos while you're designing. Photography not only helps you make the decisions in terms of records, but it also helps you design better cases. And if you're not designing them yourself, at least in understanding what you need while you're designing, you can use these photos to the benefit of your lab technician. Lab techs can only work with what they're given. And I think I really started, empathizing with lab techs when I started doing all my own casework. Digital wax-ups are huge. They really help guide, my decision-making, and also helps with communication to the patient. Certainly with those patients that are very, very demanding aesthetic-wise, it's a great framework to help us come up with a plan for the patient, and they can see it in their mouth. It's really hard for a patient to look at a model and understand what they're looking at, but when they see temporaries in their mouth, and when they're able to smile with their temporaries, if you're able to use those temporaries as a guide to come up with a digital design for their finals, those digital wax-ups really help me do that. Use those catalogs, the gingival mask, the biocopy. Certainly other scanners have catalogs that you can use, but use those catalogs. Large space closures, make sure you're prepping deep in those areas to allow yourself some space to close those embrasures. When you're closing embrasures, such as the one you see between 5 and 6 there, I'm adding to the lingual. I'm not adding to the buccal, because the buccal is going to make it look really square and not natural. So make sure you're adding to the lingual embrasure, allowing that papilla to kind of help close up the diastema. Anytime I'm prepping 8 and 9, I am definitely including a catalog of the existing dentition. Even if I don't have a biocopy, it helps me maintain that midline. Or, for instance, if I'm moving the midline, it's a great reference point. So always keep some kind of catalog when prepping your centrals. And my goal is always to try to maintain the same thickness of porcelain across all the teeth. So I'm building up on the facial of certain teeth if I need to, because that's going to give us a more uniform outcome, more natural outcome. It's not going to make one tooth look more opaque than others. So, that is something that I'm always trying to do as well. And last point, most important point, is patient communication. Communicate. Make sure the patient understands, the process, realistic expectations, and use those temporaries to your benefit to help guide the patient to a result that is attainable and something acceptable for the patient. So I'm going to just kind of talk through some of these cases in the last 10 minutes or so, and they highlight some of the points that I'd like to make. So case 1 is regarding reference data. I can't stress that enough. Having photos, having data to help reference those data points. Case 2, I'll talk about post-mill contouring, because if you've never worked with zirconia, it does feel a little different than what you may have experienced with Emax or Empress or any other kind of material. So I'll talk to you a little bit about my workflow there. And I'll talk about a lot of these cases that I really talk about pre-restorative ortho because they're going to help provide kind of a slam dunk. So I'll talk about a particular case highlighting that. Case 4 is an implant supported bridge that we did with Katana, and case 5 really highlights that conservative prep, the ability to be conservative with Katana restorations. So, reference data. And I see the Q&A, Michael, about re-showing the before and after photo, and I will do that at the end of the presentation. Certainly I will. So reference data. So this is a patient that came in. This was early on, again, in my Katana journey. He was not the most compliant with Invisalign. He was not a great implant candidate. We got a reasonable result with Invisalign, but what it allowed me to do is get that number 6 into an acceptable position to be able to restore it. Because certainly that crossbite was so significant in the before picture that I just couldn't get it. The anatomy of 7 and 8 just did not contribute well to his perio health. And he was not an implant candidate at site 11. So this was a mixed bridge single crown. And like I said, I 3D print. This is a Flexera temporary printed on a Envision Tech printer. And site development, I'll talk a little bit about that, but Pontic development is a huge part of my bridge cases as well. But the occlusal view, I think you could really appreciate how challenging this case would have been if we didn't do some kind of orthodontics first. So this is before Invisalign, after Invisalign, and then the Katana restorations on the model and in the mouth. So here is the whole workflow. And you can really kind of on the model begin to appreciate some of the contouring that goes into these cases. And when I post some of these cases on some of the social media forums, I get a lot of questions about staining and glazing, which, for sure is a part of what I do. But I think the biggest improvement that you can make in terms of the aesthetic outcome of these milled restorations is post-milled contouring. And the contouring and the way that light refracts off of line angles, it really kind of helps improve the aesthetics, makes these restorations just look so much more natural. This data, this is what I was talking about in terms of being able to see what I need to prep before I do it. And so this is our wax up. This is our current dentition. And when we see it kind of overlaid over the natural teeth, we can start to begin to appreciate, hey, I don't need to prep that much on the facial 6, but I need to prep heavily on the lingual of 6. I don't need to prep a lot on the incisal edges of those anterior teeth. So these are all things that I value about the digital approach to these cases. Here's another mixed bridge and single crown case. And this patient did, again, undergo pre-restorative ortho. The goals for Invisalign for her was to, so she had existing bridges 6 through 8 and 9 through 11, clearly stained, fractured, and needed to be redone. She had no intention to treat her lower anteriors, but thankfully she agreed with my recommendation, did Invisalign. This was only 9 months of Invisalign. And what it allowed me to do was be ultra conservative with my preparations, especially around those lower anteriors that were already quite small, but it also improved the spacing between the teeth, also helped me intrude the upper anteriors so that I didn't have, so that I improved the root positioning. So you can kind of see how the 8 and 9 was very divergent, kind of a challenging case in terms of Invisalign, but we were able to kind of move the roots a little bit to get the result that we ended up with at the end. And I wanted to highlight, how conservative we could be with our restorations. You could see that my preps are super gingival on those lower anteriors. Now, keep in mind, between 8 and 9, they were very sub-G. The original preps were already sub-G, and I actually made them more sub-G because she had that kind of unusual appearance to her papilla between 8 and 9 because of the positioning of the roots. So it allowed me to have that runway space to close the contacts without making them look divergent. So that's what I love about pre-restorative ortho. But the other thing I love about temporizing in these pontic situations, look at that pontic development. So we took our temporaries, these are 3D printed temporaries, had the patient return and could scan the pontic sites and have this really beautiful pontic development, really make it appear like the pontic is emerging out of the gum line. So this was done at the prep appointment, literally taking just like a white round stone, creating indentations like an ovate pontic, but then also putting pressure with those temporaries, those 3D printed temporaries. And what I love about the 3D printed temporaries that I don't think I got with the chairside temps is that, really beautiful margin and ability to form these pontic sites and have really nice tissue response in the temporization phase. There was a question about how effective is aligner treatment in moving 3-unit bridges. So that's a really good question. In her case, what I did for her Invisalign treatment is I actually requested from the technician to move each bridge independently of each other, but in consistent with the same tooth. So essentially 6 and 8 were being moved as a single unit, and 9 and 11 are being moved as a single unit. Of course, there's some risk to that. She already had a fracture in one of the bridges. We have some backup plans with our aligners. Thankfully, the bridges didn't fracture during her Invisalign treatment, but it just allowed me a little bit of clearance and the ability to really, you could see how much tooth structure we still have. That's a really, this is going to be a long-lasting option for this patient, being able to be really conservative. So I was able to intrude, the anterior segment in 2 segments by probably another millimeter or so, just enough to get me some more clearance. So here is the case. This is in the green state. That's the top picture. In the green state, now this leads to the next question. You mentioned katana feels different in what way? So when it's in this green state, keep in mind it's 25% enlarged, first of all. Secondly, it is like a powder material. If you drop this bridge in this state, it can fracture. It's very, very brittle and very sensitive. So if you take a coarse wheel to this, you are going to gouge it out. So what I do is very light pressure and very low RPM. I'm doing my initial post-mill contouring. So for a bridge, I'm taking a metal wheel, a metal disc, and I'm defining those embrasures. It's almost impossible to get that definition with a milling unit. So I do that post-mill. The other thing I do post-mill but pre-sinter is I might add some light anatomy. I don't overdo it here because, like I said, it's so sensitive and you can gouge it pretty easily. So I'm doing some light contouring. I'm using Meisinger wheels. There's a great Meisinger kit you can buy for Zirconia, and that's what I use to do my post-mill contouring. Now, the second picture you see on the far left is after sintering, so it comes out of the speed fire, I'm kind of, now I can go to town on this thing. So I don't have to be careful with it. I can use my coarse wheels and add anatomy. I personally don't polish the heck out of this stuff. First of all, the more you polish katana, the more pearly it gets. So if you're using a high RPM, it'll start looking kind of like this pearl effect. And it's not quite pretty, especially if you're just cementing it polished. I do that for my posterior crowns. I glaze all my anteriors, but if you might notice that if you've ever worked with any zirconia, but katana in particular. But I'm leaving kind of roughness, but I'm defining my line angles. I am polishing, and I'm defining some anterior, some incisal anatomy. And so then you could see, this is the last picture on the far left, that's post-glaze. What I learned with katana is that because the pontics are the full material, it's a thick material, it doesn't have a stump underlying it. Sometimes if you don't darken them up a hair, they will look lighter than the adjacent prep teeth. So you could see in our before and after, even though they were glazed darker, they looked uniform in the final. So this is her smile before and after. Happy patient. We were able to improve her deep bite, improve her overjet with doing the restorations on the bottom as well, and giving her a very conservative, I think, approach to her case. Patients in her 40s, she didn't want to do, and I don't think she needed any kind of full mouth rehab, but it gave her the aesthetic result she was looking for in a very conservative way. Another pre-restorative ortho case, this patient, we were able to do ortho, again, pretty short case, a little over a year. This was his Invisalign treatment. Essentially, all we're doing is we're expanding the arches, we're improving the crowding, and he had a lot of anterior wear. Ultra conservative, I think, to only address his 4 front teeth. And we were able to just, straighten up the lowers. The contours of the lowers looked really nice. So all he did was whiten his teeth, and we went ahead and put katana crowns on 7 through 10. In this case, the reason I chose katana was because I was doing very, very thin feather margins. So these were very thin preps, very, very deep. Patient had a relatively gummy smile, but the pre-restorative ortho just helped widen the smile, improve the aesthetics, certainly improve function, so that he's not wearing those incisal edges like he was before. And we were able to get this result with just 4 anterior crowns, which, looking at it, I think, it almost looks like he got more work than just 4 crowns. What type of bleaching do you offer? So this particular patient just did home whitening with Ultradent opalescence whitening. I'm pretty sure he used the 35%, but I'm not certain. But I always ask my patients, like, what do you want? If we're trying to maintain a natural teeth on the bottom, main thing is I don't want a huge, change in shade between upper and lower. That's when, things start looking fake. If a patient just wants a few shades lighter, I say, hey, you could do some, at-home whitening with custom whitening trays with opalescence whitening. If a patient says, I really want, a Hollywood smile, that's the word I use. I say, do you want a Hollywood smile? Do you want like bright, bright white? I show them shade tabs. It's kind of hit or miss with shade tabs. Some patients get it, some patients don't. But if they're looking for a huge jump from where they are, I offer core whitening. That's spelled K-O-R. Honestly, the results are unparalleled in my opinion. And the sensitivity is extremely low with core. So I've had really great results with core whitening. Unfortunately, I don't have any cases in this presentation with core, but it is a really great product. It is quite pricey. Some patients don't care and they're willing to pay. It is a long regimen in office, and there's a home portion, but it is very effective. This is an implant supported bridge. She came in looking like this. She was walking around like this with an Essex retainer for over a year, looking for a practice who could do it all. I do surgery in my practice. This particular patient had an existing bridge, 8 through 10, that fractured the gum line. We can see why, because she has quite a deep bite, not a lot of restorative space. Patient did not want to undergo orthodontics. But in her case, I thought she could actually use some crown lengthening, if you will. So I wanted to actually position the implant deeper than where her current gingival zeniths were. So we went ahead and treatment planned the case. I used CCAT for implant planning. I made my own surgical guide with the prime print. And in this case, I used Atlantis abutments, and as you can probably gather, I'm a control freak. So I designed my own abutments as well through Atlantis editor, and we were able to get this core file, a perfectly marginated bridge there. And this kind of is a little video of how I define the embrasures of the pontic, and you can kind of see the significant anatomy I'm putting in. Don't be afraid to put in that anatomy, because once you glaze over it, it really mellows out. You don't see it much anymore. So, you can see I put a lot of contouring. I like anatomy. Some patients don't. I have that conversation with them. Do you want natural? Do you want Hollywood? What do you want? Do you want toilet bowl white? Do you want natural white? So these are all things that I discussed with the patient. Patient really wanted that natural appearance. Again, pontic development with 3D printed temporaries. You could do it with chairside temporaries as well. These are the Atlantis abutments in after the patient has been wearing temporaries. And this is the final Katana case. Katana, 7 through 10 implant supported bridge. Really beautiful result. We could do this time and time again. And the fact that this is implant supported with that, tissue appearance, I'm really, really proud of that. Patient's very, very happy. Last case, young patient comes to me looking like this. Unfortunately, we were working one tooth at a time because his finances could not, he could not afford the treatment. He was in his 20s. He had a history of neglect as a child. He was not ever kind of, really parented, kind of a parent that was not around, a single parent, and was never told to brush his teeth, was given candy and soda, and this was the result in his early 20s. And he really wanted to do better, but he just couldn't. And what I love about CEREC is that I am able to make these decisions, based on a patient that presents to my practice, and he had every intention to improve his smile, but at the rate we were going, we were certainly headed towards dentures. So I decided to give this patient a full mouth rehab. I have a wonderful orthodontist in my area who did traditional ortho on him. We did caries control first, did traditional ortho, all pro bono. He ended up with some endos. I forced him to purchase an electronic toothbrush because I wanted him to understand the value of prevention, and he certainly did. He is my poster child now. So here is his case, first molar to first molar. These are Katana crowns. Just, perio, just some SRP on the bottom, orthodontics, and we were able to save all those teeth, believe it or not. And this is his final appearance, face shot. He is indebted to the practice. He is my #1 cheerleader. You have these patients in your practice. These are the cases that make you feel incredibly rewarded. The ability for me to do all my own lab work, I can, financially make sense of doing this case pro bono. And patient is like a different person, right? So his life has been changed. He says that literally every aspect of his life is different. He is Now engaged to be married. He He thanks us every time he comes in. He cries every time he comes into the practice. And these are the cases that really allow me to love what I do. Somebody asked me for my contact information. This is my contact information. My website is midtowndentalsacramento.com. That's my email. That's my personal email, gotfloss@gmail.com. You could find me on Instagram, Gentis916, and Facebook, Jenny Apekian. And I'll open it up for questions if you have any more. And Trung, is it okay if you go back to the photo? Somebody asked for the, if I could share my screen again. Okay. Somebody asked for the facial photo of the first case that I showed. So I'm just going to go back there. There we go. So there's Sydney. Any other questions before we wrap it up? I think that sounds like it's a wrap. Trung?
All right. Thanks, Dr. Apekian.
And I'll just type this in. Oh, are you still there?
Yeah.
Okay, I'll just type in my contact info in case. Oh, you already have it up. Okay, sounds great.
Yeah, it should be here.
Okay.
All right. Thank you very much.
Thank you. Appreciate it.